Located on 225 acres in Garden City, Long Island, Nassau Community College, a member of the State University of New York system, has close to 20,000 students attend the school each year. The college mascot is Leo the Lion, and these are his stories of the school's absolute best and brightest who have graduated over the past 50-plus years. So let's catch up together as the Alumni Association of Nassau Community College proudly presents Lion Tales on the voice of Nassau Community College, 90.3 WHPC.
Welcome to Lion Tales, powered by the Nassau Community College Foundation. My name is Aurora Workman. I am president of the Nassau Community College Alumni Association, and I'm here with my friend and co-host, Dr. Lynnda Nadien, a proud graduate of NCC, and together we'll share stories that will inspire, uplift, and often amuse you.
Each week, Aurora and I will introduce you to alumni of Nassau Community College interested in sharing their experience here at Nassau Community College, along with the secrets to their success. If you, our listening audience, has any positive news you would like to share about Nassau Community College alumni, engagements, births, graduations, weddings, and/or accolades, email us at alumni@ncc.edu and we will shout you out.
Well, today's guest is Mike Turso, a lead speech pathologist at St. Luke's Hospital in New Jersey, who works with a large nonprofit healthcare network and treats outpatients who suffer from a wide variety of communication disorders, and a very proud graduate of Nassau Community College. We welcome Mike Turso, class of 1986. Hello, Mike.
Hi there. How are you guys doing?
Oh, we're
Great,
wonderful.
thank you.
So let's talk about Nassau. Why did you decide to attend?
Well, it's an interesting story. I didn't really have much of a choice. I didn't do very well in high school, either academically or socially. Essentially, in the high school I went to, it was really broken up into three groups. You had the jocks, the brainy kids, and the others. I was definitely in that other group, and even underperforming in that group. And I really didn't have many options. I knew I wasn't ready to go to work. My brother and sister, who are 9 and 10 years older than I, they went to Nassau, and it seemed like, a good thing for me to try.
That's what, and a lot of people say that they came here just to kind of discover themselves, right, and to figure out what they were going to do next.
Exactly. And it was a total turnaround. High school was difficult. It was difficult socially and academically, but it was a complete sea change when I got to Nassau, where the students were just friendly. I really became friends with them. And I could really relax and absorb into what was being taught. And that was really a big turnaround for me.
And so what do you remember most about the campus environment?
Oh, gosh, it was just so supportive.
Yeah.
It was just so supportive in that students helped out each other, whether it was with an assignment or even how to act in class. It was just a sense of camaraderie, and the professors that I had were just outstanding. There's a few that come to mind. One is a great English professor that I had, Dr. Oliver, who taught there for many years. Yeah. And I only found out years later what his background was. This man was a Tuskegee Airman, which was during the Second World War. He was part of an elite group of fighter pilots who were men of color. They weren't able to serve in the Army because of segregation, but they distinguished themselves by being tremendous in terms of their ability to combat the enemy during the Second World War. And he was my English professor. He also later on went on to become the first person of color to be in a major Broadway production.
Wow.
And that was real. I was always blown away by the great quality of the teaching at that institution. And typically, it sounds cliched, my first semester there, he saw something in me that I didn't see. He took me under his wing, and he really nurtured me and brought me along. I was a a solid C student in college, in high school.
Yeah.
And then when I got to college, my first semester at Nassau, I 4.0'd. And the rest of my...
Well, it was there. Your strengths were there. He pulled it out of you. That's so amazing.
He really did.
Yeah.
And I had him for a second semester, and he really turned up the heat. He really challenged me, and it was really something else to see him understand that I had gotten my legs under me, and then he was really pushing me to the next level. So, it's people like that I really remember from the experience there.
And was that English 101? Is that what he was teaching?
It was.
Yeah.
Yes.
Because I remember those courses as well, and I always thought that I had a writing talent, but they really pulled that out of me, sitting in those classes, 101 and then 102. I felt like I really was able to, find my strength there with that. So it's great to hear that he also did that for you.
So listen,
He did.
So what advice would you give to yourself back when you were a student? With things that you know now, what would you say to that Mike Turso who walked on this campus?
I would say take advantage of every day that you're on that campus, because you, Mike, have an opportunity to sit back and absorb and learn something new from a group of professors that are very talented and very dedicated. So I would just reinforce to myself that my job was really a beautiful one, and that all I needed to do was to sit back and listen and learn. And if you had that posture, if you had that way about you that you were willing to learn, I mean, those professors really back then, and I'm sure it's true today, would really just go above and beyond just to really help you out and make sure that you learned everything that you needed to learn to take with you to the next step, whatever that may be.
Right. I mean, they truly changed the trajectory of my life, so I know that is the testimony of most of us alums in regards to NASA.
And that's a great way to say that. Yeah, it did really change the course of my life. It really did.
And I think we talk about the fact that the coursework here is there's really an intense element about it, because the courses are all really designed separately, and then you're still getting a degree. And then when you go to a 4-year institution or the next step in your career, sometimes those courses I found them to be even easier than what I had at Nassau. I left with liberal arts classes, but I was pretty well-rounded, so that was such a great thing as well.
Right, and that's something that helped me a lot, was that broad liberal arts education.
Absolutely,
that really helped me to see things with a wider lens and a broader perspective. Now, I got great technical training at Adelphi University in terms of speech pathology there as an undergraduate and then in graduate school. There's no doubt about that. I got that in abundance. But what I got from Nassau was this ability to look at myself and place myself in the universe and see how I connect with other people. And that, as a speech pathologist, has been my greatest tool, because it gives me empathy and compassion. So when someone comes into my office, I really see them almost as a reflection of myself, someone that's injured and wants to get better. And it really helps me to be a better therapist, because I have that perspective. Right. And I got that really at that campus.
Right. You're listening to Lion Tales on the voice of Nassau Community College, 90.3 WHPC. I'm Aurora Workman, along with Dr. Lynnda Nadien, and our guest today is Mike Turso, the lead speech pathologist in New Jersey. He has worked extensively with both pediatric and adult populations and strives to make each patient's appointment his most important task of the day. So, Mike, what led you to becoming a speech pathologist?
Well, I knew that I wanted to help people. I wanted to work with people, and I wanted to teach, in a sense. And I took a course, actually, at Nassau in speech pathology with Introduction to Speech Path, and it seemed to fit. It seemed to check a lot of the boxes. And I got to do all those things, not in front of a classroom, which would have been good. I get to do it one-on-one, which I find is even better, because I do get to tailor each session to each patient's need. So it really filled a need that I had to want to help people, to help them to get better. And, that's I get to do that every day.
Yeah. Are you working with children and adults?
Yes.
And how is that? What is some of the work that you do with an adult in terms of speech and language?
In terms of the adults, we see patients that may have had a concussion.
Yeah.
And that's really kind of at the forefront of what we're doing now. We find patients that have had a concussion, whether they're athletes or adults or, kids on the playground. They do end up, at least in the short term, with some need for cognitive therapy to help them with their memory, help them with attention and processing. So we do work with that group, and with the adults also if someone's had a stroke.
Right.
That might affect their language.
Yes.
They might have something called aphasia, where they can't think of the words that they want to say. They can't put their thoughts together. We work in that area with those patients. We work with patients also that have Parkinson's disease, getting them to talk better, to talk louder. And we also treat patients that have difficulty swallowing. That's in our purview also. And we also see patients with dementia. So it's pretty much anything that could go wrong with the communication system, whether it's with the adult population or the child population. We generally get involved with that.
And then when you have, little children, most of my students that I have in my school, a lot of them are, classified immediately speech and language. And it's interesting because they may have some autism spectrum, but we do see classifications with speech and language. And how do you start working with the very young, maybe the 2 and 3 year olds to hit those developmental milestones?
I try to put even the pediatric patients in a position where they need to communicate or where there's a desire to communicate. So we may work with a child and we'll ask the parent to bring in a favorite toy or something that they're interested in, and that will form the basis of our treatment. It could be a discussion of the toy. It could be a desire to play with the toy. We try to set up situations where the child, even at that age of 1 or 2, is in a situation where they need to communicate, and we help them along the way. If they can't, obviously, we'll model for them. We will repeat what they need to say, and we'll start working on connecting those dots to make sure that the kid is able to communicate. So for that young population, it's a lot of play-based therapy based on things that they're interested in, and we try to turn those points of interest into communication opportunities.
Yeah, because you see some babies become frustrated because they don't have the language yet, and they cry or they tantrum because of it. And how about the auditory processing disorders? Are you seeing more of that? And this whole controversy about giving children the injections for the measles and the mumps, and should they wait, and does that affect their speech and language and their cognitive ability?
Right. Well, we do see, and we have historically seen, a lot of kids with auditory processing. It's a very interesting disorder, and it affects both how they're able to listen to instructions, and also it impacts their expressive vocabulary, because those kids have a poor auditory memory, so they have poor retention of what words mean. So those are kids that generally speak in very vague terms. They do really poorly on all sorts of comprehension tests. But with therapy, they do get better because we are able to target those areas and really build up that area of the brain that's underperforming with a lot of good intervention and repetition and a lot of strategies that help these kids along the way.
Wow. You are listening to Lion Tales. Our guest today is Mike Turso, a lead speech pathologist in Pennsylvania who works extensively with both pediatric and adult populations and is a very proud graduate of Nassau Community College. My name is Lynnda Nadien, along with Aurora Workman, on the voice of Nassau Community College, 90.3 WHPC.
Adopt US Kids presents What to Expect When You're Expecting. A teenager. Learning the lingo.
Today I'm going to help parents translate teen slang. Now, when a teen says something is on fleek, it's exactly like saying, that's rad. It simply means that something is awesome or cool. Another one is totes. It's exactly like saying, totally, just shorter. As in, I totes love going to the mall with Becca. Another word you might hear is jelly. Jelly is a shorter, better way to say jealous. As in, Chloe, I am like so jelly of your unicorn phone case.
You don't have to speak teen to be a perfect parent. Thousands of teens in foster care will think you're, rad just the same. To learn more, visit adoptuskids.org. A public service announcement brought to you by the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
Welcome back to Lion Tales, powered by the Nassau Community College Foundation on the voice of Nassau Community College, 90.3 WHPC. I'm your host, Dr. Lynnda Nadien, along with Aurora Workman, and our guest today is Mike Turso, lead speech pathologist who has worked in adult rehab, and the healthcare is in Phillipsburg, New Jersey. We just want to make sure that we have that correct. He's the lead speech pathologist who has worked in adult rehab with individuals suffering from stroke, Parkinson's disease, and traumatic brain injury. Mike is a very proud graduate of Nassau Community College. So what should our interested listening audience major in to become a speech pathologist if they wanted to pursue that as a career?
So how should they go about that?
Yes. What would you advise them to do?
You know what? The track that I took was excellent. I went to a community college. I got that broad liberal arts background, and I discovered myself. Right. If they want to, if you have someone that's interested in that, the person really has to have a good sense of empathy and a good sense of caring and a real desire to help people, because you will see people that come into your office, or you'll go into their hospital room and they're shattered in a sense. You know, they have had a stroke, they can't talk, they can't swallow, they can't use their memory. And you have to have the fortitude to go in there and the desire to say, you know what, I see that you are suffering right now, but I have some things that can help you, and I'm here to help you. So if you have an individual that has that capacity and that empathy and desire to help people, you really have 90% of the tools that you need. From that, you need to have some understanding of anatomy and a desire to kind of really understand how language comes about. So from that neurological sense. Right.
And then the difference between a speech therapist and a speech pathologist, how would you separate the two?
You know, the both are intertwined. It's the same thing. People will call me a speech therapist. Technically, we're all speech pathologists because we have the extra ability to diagnose our own patients. Right. So the doctor will, for example, give a broad script and say, you know, so-and-so, please see so-and-so due to a language delay. And they might not be language delay. They might have autism, or they may have some other impairment that we then actually diagnose, and we send that information back to the doctor for that physician to refine their diagnosis.
Yeah, and then do you perform the swallow tests for adults, and can you check their neck and their jaw and their mouth and all of that as well? Is that where the pathology part comes in?
Yes, yeah. So we do that. It's a really interesting exam that's done as an outpatient or as an inpatient if the patient is in the hospital, where we work with the radiologist in the radiology department, and they will take a moving X-ray of the patient swallowing, and we're able to look for signs of aspiration, meaning that food or liquid is going down the wrong way, or sometimes we'll see that food get stuck. So it's a very exciting exam. It's called a modified barium swallow study. It only takes a few minutes, and it's really the state of the art in terms of diagnosing what's going on for those patients that may have Parkinson's or have had a stroke or a really severe head injury, or even pediatrics that may have some congenital difficulty swallowing. It gives us the ability to pinpoint what's going on almost instantly.
Yeah. When it comes to, I guess, little babies, again, going back to that, you know, parents seem to panic right away when they notice that a child's not developing language or they don't have a certain memory bank for words, like we were saying earlier. How would you advise some of the new parents when their babies reach the milestones, but they're really not verbally expressive. What would you say to them before they panic?
Well, first of all, know some of the early milestones, and some of them are really easy. So by the time your child is 12 months, they should have 12 words. And by the time they're 2 years, they should be putting 2 words together. So those are really big milestones that when we do the parent education piece, when we're talking to a new patient and their family, we really try to stress that. And when we work with new residents in our hospital, we try to get those early points across. So for early language development, definitely 12 words by 12 months, and you'll see words develop even sooner, maybe at 8 months, and look to see that a child has good eye contact, that when you hold a child, they are soothed by that, and that they follow some simple commands.
Right.
So if those things aren't there, then certainly go to your pediatrician even before the first well visit and express those concerns. And if the pediatrician knows his or her stuff, they will really readily refer to the speech pathologist, and we could do an excellent comprehensive exam on kids that are, well under a year.
Yeah, because the early
8 months, 9 months, 10 months, right.
Yeah.
Right.
I mean, and do you also observe, from afar, even before you're talking to a child that young, that you can sort of see, sometimes babies know a lot, but they just cannot express themselves yet.
Right.
And it could just all happen all of a sudden, and then they're talking. Have you seen that?
Mm-hmm. Yes. Yeah. Definitely. Mm-hmm. And sometimes they just need that extra stimulation to connect the dots. But you'll know, especially, it's hard for new parents to know, but, you can get a sense when you look into a child's eyes, even at 8 months, if they really are making a connection with you, even if it's nonverbal.
Yeah, exactly.
The normal child will really look at your face, will study your face and watch your mouth, because that's in part how they're learning. How they're learning to make sounds is by watching the mother, the father, the significant caregiver. Yes. So parents should be on the lookout for that, because you want that level of bonding very early on, because that's really a foundation piece for later communication.
Definitely. You are listening to Lion Tales on the voice of Nassau Community College, 90.3 WHPC. My name is Aurora Workman, along with Dr. Lynnda Nadien, and our guest today is Mike Turso, lead speech pathologist in New Jersey at St. Luke's Hospital. We have been talking a lot about the developments of a child in speech. So we are very happy that you have come here. You're part of the Concussion Center at St. Luke's in Warren campus. And Mike has had the opportunity to provide cognitive therapy for patients suffering from memory and attention disorders. Mike is also Vital Stim certified for patients experiencing difficulty swallowing. So tell us about the work you do for those patients who have. We were talking about the dynamics of the swallowing therapy,
and the testing.
And so, what makes you Vital Stim certified?
Well, that's extra certification that you would get, and it's a very exciting modality. In that, what we're trained to do is to put surface electrodes on the patient's neck, and we put them on in such a way that it stimulates the swallowing response, and it makes it more robust. So you would have someone that for reasons of maybe they've had a stroke or they have Parkinson's disease, they have very weak and ineffective swallowing. So food would get stuck, food would not go down all the way, liquids might go down the wrong pipe and go into the lungs. With the Vital Stim therapy, it really makes the muscles work more. It makes them work in a very robust way. And after about 12 to 15 sessions, most patients see a significant improvement. And at which point, then we send them back to get the swallow study redone, and it checks our progress and lets us move the patient forward in many cases in terms of having a less restrictive diet. So, you might take a patient that's on a puree diet, and we could advance them to food that looks more normal, more solid, and that's a great benefit to those patients, because then their nutrition is much better.
Right, exactly.
And now part of the work also is at the Concussion Center at St. Luke's on that Warren campus. And Now, on the news, we hear so much about concussive issues and kids getting hurt during sports and all sorts of things. How are you dealing with, the interest in concussions and children playing football and sports? How is that?
Right. Well, we do a lot of teaching and education. We really do stress preventive measures such as wearing appropriate headgear at all times. And there's a much more sensitivity in terms of coaches and athletic trainers that if a student athlete has concussed, then they are really taken out of whatever sport they're playing. They need to see a physician. We recommend the physicians in our network, but any physician that is versed in concussion, and make sure that they are checked out fully before they can return to play. Oh. So we've really taken a lot of steps to try to make sure that students are okay and able to resume those activities without potentially injuring themselves more with a second and a repeat concussion, which we're finding that those cases are much more involved. So we try to nip it in the bud with good education, and if there's even a sense that a player has gotten hurt, they really do need to go through a series of professional medical people in order to be cleared to go back to that sport.
Absolutely.
Well, in these last 2 minutes, we have knowledge that you do some woodwork. Tell us about it, because we are more than just alums.
All the alums are artists, and they do some sort of something
creative,
interesting. Yeah, very creative people.
Yes, and it was and continues to be a great creative outlet. My father was a very skilled carpenter, and he died when I was in my 20s. He passed away, and it was really a way to kind of connect with him after he was gone, that I would use some of his tools and try to create some of the things that he made around the house. And I have really done that, I must say, since you asked. I'm pretty talented at it.
Yeah.
And I've made, for my daughters, I've made them beds, I've made them desks, I made our dining room table, a nice TV unit, and it's something I just enjoy doing. It really gives me an outlet to use my hands.
Is anything on eBay?
Well, we'd like to thank you, Mike, for being with us. Mike Turso, the lead speech pathologist, educator, and a very proud graduate of Nassau Community College. And if our audience is trying to contact you, how can they?
Well, you know what? You could find us on the web. We're part of the St. Luke's University Health Network, and we work out of a division called Physical Therapy at St. Luke's, and that's how you could find me. And if you have any questions about speech therapy or physical therapy or occupational therapy, you could always drop us a line there through that website.
Thank you.
Yeah, we want to thank you for being with us. My name is Dr. Lynnda Nadien,
pleasure.
Along with my fabulous friend, Aurora Workman, President of the Nassau Community College Alumni Association. The Creative Director of Lion Tales is Rudy J. Breedy. This show is a production of the Nassau Community College Alumni Association. Visit ncc.edu/WHPC for more information. Available as a podcast on iTunes, Android Podcasts, and Spreaker. Lion Tales is powered by the Nassau Community College Foundation on the voice of Nassau Community College, 90.3 WHPC. We'll talk to you next week.